as we go through the branch of the brachial plexus, we can examine and discuss the muscles along with it. All right. So, as you can see, so why don't you get that model in front of you, the model, okay, the ones, okay. Yeah. Okay, so if you look at this, you would have like, starting from C5, C6. Can you see the model too? C5, C6, C7, C8, and T1. So how would you differentiate these two? Like C1, okay, 5 and 6 they come together. 5 and 6, 5 the root, the entry rami of the spinal nerve. 5 and 6 they come together. They form the superior trunk, the upper trunk. 5, 6, 7. You see, that doesn't connect with any other. That's 7.
They make the middle trunk.
Right, it makes the middle trunk. And then we have 8 and T1, they come together and they form the inferior trunk. Okay, so we have this is the upper trunk, the middle trunk, and then we have the inferior trunk. So where are these located? They're located above the clavicle. This is the clavicle. So this area, the roots and the trunks are located where? Above the clavicle. So therefore these areas are referred to as, or the part of the brachial plexus is referred to as the supraclavicular part of the brachial plexus. So the supraclavicular part of the brachial plexus, we see the roots and then we see the trunks, right? Okay, good.
Is there more lower than...
So, no, right, and then we're gonna go to the infraclavicular part of the brachial plexus, but hold on for a minute. So we have the roots and the trunks of the supraclavicular part of the brachial plexus. Okay, so starting from the roots, so we have two nerves that come out from the C5. Well, see, let's say C5. C5, there's a nerve that comes out from C5. So what is it?
Dorsal scapular.
Dorsal scapular nerve. And the other nerve is?
Long thoracic.
Long thoracic, but long thoracic gets contribution from?
Everything.
Right, C5, C6, and C7. Okay, that's long thoracic nerve, which we had confusion this morning, okay? We were talking about I was talking about long thoracic, but it was apparently thoracodorsal, okay? So it's 5, 6, 7 is long thoracic, and C5 is dorsal scapular. So these two nerves come out from where? Roots, okay? The roots. They come out from the roots. So these are the roots of the brachial plexus. So these are initial segments of the brachial plexus, the roots. All right. So the roots, they come together, they form the trunks, the upper, middle, and inferior, or superior, middle, or inferior trunk, lower trunk. So from the trunk, there's two nerves that come out from the upper trunk, which is?
Suprascapular.
Okay, everybody say it. Suprascapular nerve and? Right, nerve to subclavius. So we have two nerves. So two from the roots, two from the upper trunk. Suprascapular nerve. Suprascapular nerve that come out from the superior trunk, the upper trunk, innervates which muscles? Everybody, 1, 2, 3. No. Suprascapular nerve. Suprascapular nerve innervates
From the superior trunk.
innervates which muscles? Supraspinatus, infraspinatus, and?
The major, teres major.
No, there's no and. I'm just confusing you.
Okay.
So there's only two muscles that suprascapular nerve innervates, supraspinatus and infraspinatus, okay? So we have, so those are two muscles that this innervates. So let's say, there's a lesion in the suprascapular nerve, okay? And for instance, there's a compression of suprascapular nerve as it passes through the suprascapular foramen. Remember, we had the notch or incisura, and you have the ligament, transverse scapular ligament, and beneath the ligament you have the passing through the suprascapular nerve. Let's say there's a irritation or inflammation of the tendon or the ligament, okay, and it compresses the suprascapular nerve. Okay, so there's a compression of suprascapular nerve. Okay, what would you see in the patient or the person? that has a suprascapular nerve compression or entrapment. So you try to learn these words, so compression, entrapment. Entrapment is also compression, okay? Presses the other nerves. So what would you see in the person, yes?
I cannot feel pectoralis major because of
Pectoralis major?
yeah, because
No, this we're talking about suprascapular nerve.
They
Okay,
can
raise
do abduction.
suprascapular nerve,
suprascapular nerve.
supraspinatus they
From
They
measure
can,
extremis.
they can do the abduction from 0 to 15.
Yes.
Okay, so that's correct. So one of the important function of the suprascapular nerve, ear nerve, is supraspinatus, right?
And the elevation.
And the infraspinatus. So infraspinatus, what's the function of infraspinatus? Right. So we have the adduction, extension, and external rotation. But is that important?
No.
No, because the other muscles can do that motion, right? But however, 0 to 15 only supraspinatus. Don't forget that. So what would you see in that patient? What particular function will be lost? Would be 0 to 15 abduction. That's a lost, okay? So you don't have to think about the infraspinatus because other muscles can compensate infraspinatus, but no muscles can compensate the supraspinatus muscle, which is 0 to 15 abduction.
Doctor, but
Is that understood?
yes.
yeah.
Okay, that's my question, the test, okay?
If it was 0 to 15, it doesn't work. So it will not work from 15 to 90, right?
Okay, so for instance, let's say this patient has suprascapular nerve entrapment as it passes through the suprascapular foramen, okay? And so he has, so that's like that. My question is, will there any, will the abduction of his arm diminished, okay, so or lost? Will there any abduction action lost or of this person?
You just have to support him from 0 to 15.
Okay, you just have to support him from 0 to 15, okay? That's the answer. So basically you have suprascapular nerve damage, so he can't do this. So the other muscle is what?
The
Deltoid is working. Actually nerve is working. So after 15 degrees, yes, he can do abduction. So what you need to do, you just have to give him a lift. Give him a lift, and then he will do abduction, okay? All right, good. Okay, so let's continue. So we finished the trunks, okay? All right. And behind the clavicle, like the mid-third of the clavicle, you have the formation of the divisions. So what divisions do we have? We have these anterior-posterior divisions. Anterior-posterior, anterior-posterior, anterior-posterior, okay? Now, the anterior division of the upper trunk and the anterior division of the middle trunk, they come together, two anteriors, and they form, you see this is the anterior division, I don't know if you can see it. See it on the model, please. You have the anterior division here, this is the anterior division. Okay, you see this? Okay, this is the anterior division of the upper trunk, this one here. Anterior division of the upper trunk. And this is the anterior division of the middle trunk.
Green one,
Right, these two green ones. They come together, they form the lateral cord. Okay? They form lateral cord. Okay, we got that. Now let's look at the anterior division of the lower trunk. So the anterior division of the lower trunk, it doesn't connect with anybody. So the anterior division of the lower trunk itself forms the medial cord, güzel, okay, and the posterior divisions of all trunks. You see this is the posterior division, you see? Posterior division of the inferior trunk, this is the posterior division of the middle trunk, this is the posterior division of the upper trunk. All the posterior divisions of the trunks, they come together, they form the posterior cord, okay? So we got that. So these cords, so we would see these cords, in the axilla, or the axillary fossa. Axillary fossa, all right? Now after that, after the chords, what do we see?
Branches.
Terminal branches. Now terminal branches, we would see the terminal branches in the arm, in the brachium. So these are the terminal branches here. So these are the terminal branches. So the important thing that you need to, in order to differentiate terminal branch, you have to recognize or locate the M. M, you see the M here? Okay, this is the M here. You see this is the medial head. Okay, this is the medial arm of the M. This is the middle arm of the M, and this is the lateral arm of the M. This one here. Okay, it's this. This is the M, right? The medial arm of the M. This. Okay, let's start with this. The lateral arm of the M is the terminal branch is musculocutaneous, right? Lateral arm of the M. The middle of the M, the middle arm of the M is median nerve. The medial arm of the M is ulnar nerve, right? So if you look at the median nerves, we have the medial root and lateral root. Okay, so this this is the lateral cord. It gives off two branches, musculocutaneous, and the other is the lateral root of median nerve. The, the lower cord, the inferior cord, okay, it gives off two branches. One of them is the ulnar nerve, and the other is the medial root of median nerve. Medial root, lateral root, they come together, they form the median nerve. This one here is the posterior cord. Posterior cord gives off two branches. This one here curves around and forms the axillary nerve. This one goes to the back through the spiral groove and forms a radial. Okay, that's the terminal branches. So let's go up and look at the chords. Okay, so this is the lateral cord. So why do we call this lateral?
Because it's lateral for axillary.
Right, it's because it's located laterally to the axillary artery. Why do we call this medial cord? Because it's medial to the axillary artery. Why do we call this posterior cord? It's posterior located to the axillary artery, that's why. Okay, so these cords, so in the lateral cord we have one branch. What is it? One branch that comes out from the lateral cord. Lateral pectoral nerve. Lateral pectoral nerve segments the levels C, C5, C6, C6, C7, correct. And lateral pectoral nerve innervates
The pectoralis major.
pectoralis major and pectoralis minor. Is that correct?
No, only pectoralis
No, it's not
major.
correct. Only major. Okay? So medial pectoral nerve innervates only pec major. Okay, pec major. But don't forget that, okay, so that's that. And then we have, the medial.
It's major.
Okay, so that's, I'm sorry, lateral pec. This is lateral pectoral nerve, not medial. Okay, lateral pectoral nerve innervates only pectoralis major. Okay. Now let's get to the medial cord. Medial cord gives off three branches. Again, one is medial pectoral nerve. Okay, medial pectoral nerve is the segments level is what? C8 and T1. C8 and, so this medial pectoral nerve, because it's coming out from the medial side, that's like the lower aspect, that's C8 and T1. The lateral pectoral nerve is the upper part, and that comes from the upper segments of the brachial plexus, which is C5, C6, and C7. Okay, so this is medial pectoral nerve goes to which muscle? Pectoralis major and pectoralis minor. Okay, so I asked a question in one of the tables. I said that if there's an injury to the medial pectoral nerve, if there's an injury of the medial pectoral nerve, which muscle would be inactive or non-functional? Right, only minor. Why? Because the minor receives medial pectoral nerve. However, the major receives both. Okay, and so major would be functional, but it won't preserve its full function. Okay, it will be like diminished a little bit. Okay, so that's that. So what else do we have in the medial cord? We have the medial pectoral nerve. What else? And then we have two cutaneous branches that come out from the medial pectoral nerve. Two cutaneous branches is what?
medial cutaneous nerve.
Medial cutaneous nerve of the arm.
Medial, right? Medial cutaneous nerve forearm and medial cutaneous nerve of arm. Okay. So basically, where does it receive it? In the medial side of the arm and the medial side of the forearm. So medial side of arm is received by medial cutaneous nerve of the arm or medial brachial cutaneous nerve, and then we have the medial cutaneous nerve of the forearm or medial antibrachial cutaneous nerve. So these are what? Sensory. Cutaneous, what does it mean? It means that it receives sensation from the skin. What sensation? Touch, pain, temperature. Okay, when you touch it, you can feel it. That is received by these nerves. So that's that. How about the lateral part of the forearm? Lateral part of the forearm. So which nerve receives the skin sensation from the lateral? Say? Musculocutaneous, right. So musculocutaneous, after it innervates the BBC muscles, it becomes superficial, and it will go to the skin, and that is called the lateral antebrachial cutaneous nerve, and that's basically a continuation of the musculocutaneous nerve. So we got these two, right? We got the medial of the arm. How about the lateral of the arm, lateral part of the arm? The lower part, like lower lateral part of the arm. Is radial, right? So lower lateral or inferior lateral part of the arm or the brachium is radial. Okay, radial. That's one, radial. At the back of the posterior of the arm is again radial. Posterior of the forearm is again radial. So radial is primarily than the posterior. The only exception is here, is the inferior lateral of the arm, inferior lateral, as radial. Posterior of the arm is radial, like the posterior cutaneous brachial cutaneous nerve. And then we have the posterior antebrachial cutaneous nerve. These two are what? Radial. Okay? The only thing that we have left is the upper part of the arm or the lower part of the deltoid, which is axillary, and we call that as sergeant patch. Right, these are sergeant patch. Where is it located? It's
Below the deltoid.
It's the lower part of the arm or below the deltoid. Above the deltoid, like somewhere around here, is supraclavicular nerve. Okay, so all these are what? The sensation. So if let's say I would ask a question like, lower part, a person came, he said that at the lower part of my deltoid, I can't feel anything. There's numb, there's tingling sensation, there's burning sensation when somebody touches my skin in the lower part of the deltoid, I can't feel anything. So what would you think that which nerve is damaged? Axillary nerve. Okay, so a person came, he says that the posterior aspect of his forearm, okay, he can't sense any information or skin sensation. What nerve is damaged? Radial nerve. Okay, good. How about the if he came, he said that on the medial aspect of his arm, he can't feel anything. Medial aspect of his arm.
Medial cutaneous nerve.
Okay, medial cutaneous nerve of arm, medial brachial cutaneous nerve, and which of the following areas could most probably be damaged? Like, which part of the brachial plexus would you expect to be damaged?
Lateral cord.
Medial cord.
Okay, so this nerve is what? Let's go one by one. This nerve is medial brachial cutaneous nerve, right? So where does it come from? From a brachial plexus.
Medial cord.
Medial cord. So there's a damage in the medial cord. Okay. All right. Okay, so that's the cords. Okay. Now let's go down. We don't have any branches and divisions. Okay, let's get to the terminal branches now. So the lateral cord, which is this lateral cord, the continuation lateral cord is this nerve here. So this nerve is what?
It is
Radial?
Which one?
Musculocutaneous, correct.
Left.
So that's musculocutaneous.
Yeah.
So musculocutaneous innervates which muscles?
Lateral cord.
Biceps, brachioradial, coracobrachial.
Right, BBC muscles. Right, BBC muscle stands for, say it again. Biceps. Okay, biceps brachii muscle.
Coracobrachial.
Brachialis muscle. And coracobrachialis. Let's say it all together once more.
Bicep brachial muscle, the brachial muscle, coracobrachial.
Okay, good. So these are what? BBC muscles. All right. So these are what? Motor fibers that innervate these
So I was
muscles.
like,
Okay. And let's say, okay, the person, you have noticed that he has damaged the musculocutaneous nerve. Okay. What would you see in that patient? Okay, so will he have any troubles in flexion the arm?
Yeah.
Okay, so arm or forearm?
Arm.
Okay, there's also like deltoid can flex the arm too. Okay, deltoid, for instance. Okay.
forearm.
So flexion of the arm, other muscles can
Like this.
provide this function of flexion. Okay, other nerves. But however, primarily these muscles are involved in flexing the forearm. Okay, so you would have troubles in flexion of the forearm. That's one. The second is important is what? So supination. So he would have troubles in supination. Although there's also supinator muscle, right? But the powerful supination muscle. So what would you tell them to do? Like right. So you would tell them to do this motion or to open the door, open the doorknob, you know, or do a supinator function or use a screwdriver. Okay. And they would do it because you would have a supinator muscle. Okay. But here it's not forceful. Okay. You would see that they can't do a forceful supination function. And so, what else would you expect to see when there's a musculocutaneous nerve damage? Besides the motor activity, there's also what? Sensory. How about sensory? So, what would you see in that patient?
Loss of sensation.
Loss of sensation where? Lateral forearm, right. So lateral forearm, the anterior aspect of the anterior lateral aspect of the forearm, the sensation will be lost. Okay, that's good. So that's musculocutaneous, BBC muscles. Don't forget that. Okay. So, okay. So so that's that. How about? Okay, so let's look at the posterior cord now. Posterior cord gives off axillary and radial. This is axillary. Axillary innervates which muscles? Deltoid and teres minor, right? Okay, and we talked about a lot about deltoid. I'm just going to leave it there. So, which particular space does it pass through? The axillary nerve. Which space? Quadrangular space. Okay, along with which artery? The posterior circumflex humeral artery. Good. Okay, and this nerve here is radial nerve. The other branch of the posterior cord is radial nerve. Radial nerve. Where is it located in the arm region? Radial nerve.
Arm and forearm.
In the arm. Where is it located? Is it
In the groove.
is it located anterior to the humerus?
Posterior.
Okay, it's posterior to the humerus in the
Spinal
spiral groove or radial groove. Along with which artery?
Profunda.
Profunda
Brachii
brachial
artery.
artery.
Okay, so that's the radial nerve. Okay, so basically this is the arm region right now, so I'm not going to go into that. And so after it goes down, remember it on the lateral side, the radial nerve, and it goes through a muscle. And remember we talked about the arcade of Froese. So it divides into superficial deep branch. And that muscle is what?
Superficial olan
What's that muscle? What's the name of that muscle?
brachioradialis.
No.
What is the question?
Okay, the question is, so the radial nerve after it passes the arm, it comes to the forearm on the lateral aspect. It passes through the two heads of a muscle. It passes through that, and you have the superficial branch and a deep branch. And deep branch goes in between these two heads. The deep branch. That muscle is
Dextroditor.
no,
Quad something?
and it passes through what we call as the arch. Okay, we could also that like the radial tunnel, and that arch or arcade of Froese. Okay, or Frost. Sometimes they call it Frost or arcade of Froese.
Brachioradialis. Şu en lateraldeki işte, en dışta. İsmini mi yanlış söylüyorum hocam?
Doctor quad something? Quadrocervical something?
No. Is it
Is
supinator?
it one of the four muscles?
Is it supinator?
I think so.
Huh? No? Yes? Okay, so you don't know. You haven't studied that. Okay. I'm just going to leave it there because you haven't looked at it. Okay? And okay. So that's the forearm. So that's not our topic today, okay? It's the forearm. So we're going to have another lab
Is it
in the
one
forearm.
of the four muscles that come from here?
Okay, so the pronator teres, yeah, the pronator teres, between the two heads of pronator teres,
Passes.
the median nerve passes
Yeah.
through there. That's median nerve.
Oh, okay.
Okay, that's median nerve. Okay, anyhow, so we're gonna get to the forearm, okay? And so that's the radial nerve. So which other nerve? And then we have the median nerve. Okay, median nerve. Oh, okay, my question. And then we have the ulnar nerve, coming from the medial cord. And so my question is, which muscles does the median nerve and ulnar nerve innervate in the arm?
The owner 1.5.
Okay, the ulnar nerve, and my question, let me repeat my question. The ulnar nerve and median nerve, which muscles are innervate in the arm region?
Oh, arm.
Profound something?
No.
Bicep.
لا لا.
Okay, is it a good question?
No.
Okay, the answer for this question is
No answer.
there is no muscle. Okay, why? Because median nerve and ulnar nerve innervates muscles located in the forearm. Okay. All right. So the only muscles in the arm, we have the BBC muscles in the arm, and at the posterior aspect we have triceps. BBC muscle is musculocutaneous, right? We talked about this. And the posterior arm muscle is triceps, and it's innervated by? That's innervated by? Say it? Radial, right. The posterior, the triceps, brachii, is innervated by the radial. So we have two nerves that innervates the arm muscles. Musculocutaneous at the anterior, on the posterior is the radial. How about the median and ulnar? They're on innervated. So when it comes to the forearm, then they start to innervate and gives off motor and motor branch, not sensory. Okay. That's another question. So which area does the ulnar and radial nerve, ulnar and the median nerve innervate in the forearm? The sensory innervation.
Ulnar medial side.
Of the forearm.
Medial side.
Of the forearm. The median nerve and ulnar nerve. So which areas of the skin sensation is innervated in the forearm of median and ulnar nerve?
Ulnar medial forearm.
Okay, the answer is none. We're talking about the sensory. So this is motor. That's the motor, right? So we have what? Motor, 1.5. Flexocarpi ulnaris 1. And the medial side of the flexor digitorum profundus. It's a half. 1.5, that's motor, right? And the rest is median nerve, that's again motor. How about sensory? Where is the sensory? It's in the hand, okay? The sensory innervation of the median ulnar is located in the hand. The medial 1.5 and lateral 3.5. Medial 1.5 is ulnar, lateral 3.5 is median. And dorsal 3.5, lateral dorsal 3.5 is radial. So we have the ulnar, median, and radial. That's the sensory innervation. However, the radial, they do have innervation of the posterior forearm and the posterior arm, all the way. But median and ulnar don't, okay? They only have motor innervation in the forearm, and they only have sensory innervation in the hand. Okay, good. I think that's about it.
And so what is the anterior side of the forearm and the sensory?
You tell me. So he's asking me, what is the we talked about this, but what is the anterior part of the forearm, the sensory cutaneous nerve? Medial cutaneous nerve, and then lateral cutaneous nerve forearm, which is a continuation of muscular tenuis. Okay?
Yeah.
Okay.